Hi, this is Tamika Chambers, and another question here is an in-class coach tutor helping you to make sense of these questions. When assessing a male client with pheochromocytoma, a tumor of the adrenal medulla that secretes excessive catecholamine, Nurse April is most likely to detect. As always, I recommend that you have something to write with, something to write on. Keywords are often your age, your medical diagnosis, and signs and symptoms, as well as select all that apply, except and do first. Anything that really quantifies that you got to do something now, or do all of them, or none of them, or one of them. So when we look at this question here, so would you most likely detect a blood pressure of 130/70, or B, a blood pressure level of 130, blood glucose level 130, bradycardia, which is C, or blood pressure of 176/88. That's why it's so important to make sure you read these questions, you guys, because sometimes we can see things, right, that are not there. So go ahead and select your answer, and then pause and select your answer and come back. So keywords, I'm looking at pheochromocytoma. They already tell me what it is. It's a tumor of the adrenal medulla, so I didn't have to memorize anything. But it says it secretes excessive catecholamines. And what I found out with a lot of nursing graduates and class candidates is they don't know what catecholamines are. And those are your fight or fight chemicals, your epinephrine, norepinephrine. So they are released from the adrenal gland, and they're getting a lot of it. And that makes sense because they have a tumor, and usually tumors put out more than enough, right? And so when I think about that, I think about flight or fight. And I think about your blood pressure go up, your heart rate goes up, right? The force of contraction, the heart rate goes up, which puts more blood into the vessels. And so it's not going to be bradycardia because epinephrine stimulates your heart. And blood glucose is actually pretty decent. So that's not what they're really pointing at. So I have two blood pressure readings. One of them is slightly elevated, the top number, systolic, but the bottom number is decent. And if we look at D, we have an increased elevation of blood pressure. This is a nurse's lab question. The answer is D, because epinephrine, again, increases the heart rate, the force of contraction, puts more blood out there, therefore increase their blood pressure. So always know catecholamines are those flight or fight chemicals. So when you think of that, that can help you easily. All right, I'll talk to you guys soon. Take care of yourself. Remember, you got this. And take your time and break down these questions, understand what they're asking you, and read the statements fully, and then ask yourself, what do I know? What do I know? All right, talk to you soon.